So Dr. Fetchy said, well, we're going to go ahead with this LITT process. And I had never heard it before. And so he was kind of telling me what to expect. And it sounded pretty easy, but then again, kind of a brain surgery doesn't exactly sound easy. So I don't know. I had mixed emotions about it, but I had full confidence in Dr. Fetchy. He's the best. So I listened to him and I went in January of 2022, right after, I think it was like the second or third. So it was like right after New Year's. And I went in and of course they had me in a holding bay and took all my vitals and everything. They gave me a anti-anxiety pill. So I wasn't nervous because I was really nervous, as would anybody. And we started to go back and I wasn't under, which with my other brain surgeries I was already under. So I do remember being wheeled right into that OR, which is pretty intimidating. You go in and there are just lights, hardcore lights beaming down on you. And there's so many people. You don't realize how many people are in an OR when you're having surgery, but there were so many doctors and nurses. And I do remember talking to the anesthesiologist, and he was great. And he was trying to make me feel, comfortable. And they were all great. There was one woman in there braiding my hair while another one is, taking vitals. And I mean, they were all great and making me feel comfortable. One was even joking, telling me jokes, trying to get me to relax a little bit. But I was really nervous, and I noticed that there was a huge MRI machine in the OR. So, and I do remember hearing that occasionally throughout the surgery, they would have to run me through the MRI to just make sure it's exactly where it needs to be, kind of thing. And so I think I had to go through that. I don't know how many times, but I'm sure they ran me through that a time or two through surgery. And then they started positioning a halo on me, which is kind of this metal, keeps your head straight and still and doesn't let you move. You kind of have these screws that kind of screw into your scalp all along the way. And that's the last thing I remember. I remember getting a halo put on, and then it was good night. And then I woke up. It felt like it was maybe 20 minutes I was asleep, but I remember waking up in the post-op bay and feeling no pain. I didn't have any pain at all. I was fine. In fact, I was up talking, moving, my kind of usual jovial self, trying to talk to nurses and like, hey, what's going on? And I noticed that I had this really cool haircut all of a sudden. So I had, my normal hair, but then they decided they were because they had to go in right above the ear, that they were just going to shave this part. So I had just a shaved hunk right over my ear. So I had this really cool haircut, and I thought maybe I'm going to try to make this trendy, but didn't work. But I honestly have no regrets. I mean, it was tiny. The incision was Dr. Fetchy described it as the end of a pencil eraser. And I don't know if I believed him at first, but then once I got out and saw it, I only had 3 stitches, I think. And it was tiny. In fact, I will show you. This is all I had. My little cool haircut, and then this little tiny incision, which to this day, I mean, you can't see, there's nothing there. I have all my hair back, no scar, no nothing. It was absolutely painless, and I would absolutely do it again if I had to. And in fact, I might, because I went in a couple months ago, and they found another little spot, and this time is on the right side, kind of over here. And they said it might be another good spot that we could do the LITT procedure, which if it is, I have no hesitation about it. I would do it again. And especially if Dr. Fetchy is doing it, I mean, forget about it. No question, I'll do it again. It was painless. It was easy. I mean, I honestly can't say enough good things about a surgery, but honestly can't say enough good things about it. I'd rather do that than any of the other surgeries I've had. I feel the need to kind of tell you what it is. It's just this little tiny opening that they kind of create for themselves. And then it's kind of just, it's a laser that goes in and just heats it and kind of melts it all away, if you will. And it almost kind of reminds me of like one of those laser cat toys. Well, that's kind of what they're doing. They're just going in there and kind of melting it all away in there. So it was super, super easy. I would absolutely do it again. But the only thing I'll say was not the procedure itself, but after the procedure, I felt 100% normal. But once I got home, they put me on a medicine, standard of care. They wanted to put me on an anti-seizure medication. Not that I had had any seizures in my life, but just to be sure. It's not going to undo anything that they had just done. So they put me on a drug called Keppra. And I will say that that is probably the worst I had of the entire procedure. I just kind of felt like a zombie. I didn't feel like myself. I had no interest in the world. I didn't like it. I didn't like it at all. But my husband called one of the head nurses up there and asked if I could come off of it. And luckily I had been on it for a couple days at this point, and they said, has she had any seizures? My husband says no. So they said, yeah, absolutely take her off. And I am not the first person to complain of this drug. And actually they told me that, in the years that they've been prescribing Keppra, that you think that they would come out with something a little bit newer, a little bit easier, but they haven't yet. So Keppra is still the standard of care after any sort of surgery like that or procedure like that. So, but other than that, that was the only downfall to it all. But then I did have a quick 5-day radiation stint just to that little area. So I got to use her again because I had just used her not too long ago. So I was able to just use her again and not make a whole nother mask because I already have a room of these masks. So I was able to use her again.